Hi, this is Mark Grossarth from Heritage Family Credit Union. Heritage Family Credit Union is a proud sponsor of the 2020 Bennington Chamber of Commerce Lunch and Learn series. I hope you find these seminars insightful and educational.
Good morning. My name is Matt Harrington. I'm the Executive Director of the Southwestern Vermont Chamber of Commerce, and you're joining us again live on Facebook or watching on CAT TV for the fourth update we provided with COVID-19, the first two with SVMC, Southwestern Vermont Medical Center, and the last one was with United Counseling Services. We're back again to provide another update with Tom D., President of Southwestern Vermont Medical Center, as well as the Chief Medical Officer, Dr. Trey Dobson. They're back again in the studio. We are observing our 6-foot distance again out of respect for what's being asked. And we come to you and provide you information as we find it relevant and as we want to update both our chamber members as well as the community at large. And so hopefully you are joining us either on Facebook Live, and I'll encourage you again, if you are watching on Facebook Live, we are taking comments and questions, and we can pass them along to Tom and Dr. Dobson. And so if you do have a question, now is the time to ask it, and I will try to get to as many as possible. I'll have with me my handy dandy notepad that we'll be doing some notes off of, but really this is a time to hear from Tom D. and Dr. Dobson about updates from both the hospital and what they're doing, as well as the state preparedness. So Tom, maybe we start right off. The bigger news, perhaps, than maybe even COVID over the last couple weeks, at least from yesterday, was that the hospital will have to furlough many of its employees. And so I thought this would be a good opportunity just for you to provide some talking around what does that mean for the employees, what does that mean for the hospital, why did it happen, and maybe most concerning, how does that prepare us for COVID-19 or future health care needs in the region?
Well, thanks, Matt, and thanks for the invitation to be here today. And yeah, you know, yesterday was a very difficult day. We don't make those decisions lightly. Actually, you know, we've been working very, very hard, our team, for the last 4 or 5 weeks, led by Dr. Dobson, who's doing a remarkable job, and our whole incident command to prepare the health system for the COVID-19 pandemic. And we made some decisions a few weeks ago to start to ramp down our business, and that really came out the recommendation out of, you know, CDC, but also the governor, in terms of the recommendations that all hospitals would try to prepare to handle the COVID patients. So we made a decision that we would have to stop doing elective and non-urgent work. And certainly that's had a major impact on our institution. If you look at our overall volume and revenue, we're off by about 75%. And you know, we're about a $200 million operation, our system wide. So with the volume of work going down, we made a decision that we would have to start to furlough employees. And again, we've been trying to hold off on doing that. So yesterday we made announcements. We had about 38 employees were furloughed yesterday. We think that over time, over the next week to 10 days, we'll probably hit close to 100 employees. And you know, just to make it clear, we're not laying people off. We're furloughing them. They continue to be our employees. They are in good standing. We maintain their health benefits, and we want to bring them back as soon as possible. And we think as the surge starts to hit, we will be bringing some of those employees back. Now, we made a conscious decision that primarily the employees that are being impacted here are non-clinical support staff, administrative, clerical folks that play an incredible role, but we're trying to maintain the bedside team to be available for the surge needs. And some of the people, as we bring them back, will probably be redeployed into other support positions to help the clinical team. So things are very different right now. The healthcare system has had a significant impact. We've done, I think, great preparation work. We're getting ready to we geared up so we can probably double and maybe even triple some of our existing volumes. So again, Dr. Dobson has done a yeoman's job in terms of leading that preparation. But this was a step that we had to take. We're literally losing millions of dollars each week, and we know we have to take everything possible. And this was the last step. What we've done prior to that is we went out and worked with our banks and got a working line of credit of $15 million, which was terrific. Medicare is working with us, and they are advancing us 3 months worth of payments. We're working with our vendors, and they've been terrific in terms of trying to extend some terms to us. We did salary adjustments for upper management and some physician compensation arrangements we're looking at. And we've also started a COVID relief fund, and that's in the community has been remarkable in terms of their outreach to us, where they have supported us to the tune of over $300,000 in less than a week. So those are remarkable things that are going on here. And my commitment to our workforce is to bring them back as soon as possible. This is something that I personally take as our challenge. We know we're the largest employer in the region, so when we have to do things like this, the ripple impact is significant. So these are extraordinary times. They're requiring us to do extraordinary things that we would not normally do, but we will take the steps necessary. We will ready ourselves. I think we'll do a great job in terms of dealing with the surge needs, and over time we will get back to where we were, but it's going to take some time.
Some might be watching and asking, what about the stimulus package? And I don't know if you have any new information, or is that really on the horizon, that eventually, through that stimulus bill that was passed last week, that there will be funding eventually for hospitals, especially the size of Southwestern?
Matt, we're hopeful. The stimulus package for the hospitals and other related healthcare entities is about $100 billion. So there's a tremendous amount of money there. Now that's for the whole country, and what has not been determined yet is the allocation of how they're going to allocate those funds. We're hoping to get more information very, very soon, but we have not yet got that, and it's something which we think down the road will be coming, but we're not sure if it's going to be coming quickly. And one other thing I want to just say about for the employees, because as we sit down and talk to them about the furloughs, if there's a silver lining here, the silver lining is through the enhanced package of unemployment benefits through the federal and state support. The good news is that as we look at most of our employees who've been furloughed, the vast majority of them will be able to maintain very close to their existing compensation arrangement with the hospital. So that was good news for us. We have to make sure we can try to get them to enroll and get that money as soon as possible, but we're hopeful that will happen quickly.
Great, thanks, Tom. Let's go over to you, Dr. Dobson. I think let's start with general updates about the virus, perhaps how it pertains to Vermont and our section of Vermont. Any new discoveries coming out there? Give us a general update about how we're handling at a regional and any new news kind of globally.
Sure. Well, last time that we spoke, I started off by saying that there is humility in recognizing there's much we don't know, and 2 weeks later, we know more, but there's still a lot that we don't. Since we talked last, the state released their model, their prediction of how the volume of patients in Vermont that become ill with the disease looks to play out. I think many people have seen this. They had a worst case scenario and a likely scenario. And even with the likely scenario, the volume of patients exceeded the capacities in the hospitals in certain areas. So let me just talk a little bit about what that means and what models mean, because there's many models out there. They're all accessible on the internet. Some of them cause panic if you look at them, and others are clearly not realistic because they've already sort of come and gone. What the models are able to do is say that the incidence of the disease will be high. And incidence means the number of people that will contract COVID. We think it's 50 to 75% of people. That's incidence. What the models aren't good at doing is predicting prevalence, and that is how many people have it at a given time. So let's just say over a 1 week period, what is the prevalence of the disease? And if the prevalence is really high, it's hard in the healthcare system to take care of those patients. If the prevalence is low and the incidence is high, we can still take care of them. It just means the volume in the hospital is higher than normal over a longer period of time. And that's where a state like Vermont really struggles, because the models are geared towards dense urban areas with a core of people that live in a vertical arrangement. They're not really geared towards individuals that are spread out and when social distancing has been put in place. So I commend Vermont's done a super job. They're preparing us. It looks like the next 3 weeks are really going to test our resolve and our resilience in the healthcare system as well as in the community. But how it plays out when we come back 2 weeks from now and 3 weeks from now to talk to you is still unknown. So we are planning that our volume, as Tom said, could increase inpatient-wise up to 3 times what the normal volume in the hospital is. And the way we've been doing that is by eliminating the non-urgent procedures so that those patients aren't in the hospital currently, and then by identifying locations around the hospital that normally are used for other types of services, and then having as much staff available. If we do triple, if our volume really does triple, we can't maintain that for long. That will be a stretch on our resources and our staff. But we do believe we can accommodate about 100 patients in the hospital over a certain amount of time. And fortunately, the state model, most likely scenario, fits in there. We have equipment and we have the staff training regularly, but it's going to be tough.
I was going to ask, how are we doing in terms of supplies and even training, so maybe you can go into that.
Sure. So the equipment that most people see in the media are 2 things. One is called PPE, which stands for personal protection equipment, and that is the mask that you need to wear, the eye protection, the gloves, and then the gown. Those are the components of the PPE, and that's what's been in short supply, the types of masks throughout the world, and particularly in the United States. We at SVMC have a fairly good supply of those items, and when I mean that, we believe that we can go through this current peak that will occur in April and come out of it without the need to change the way we take care of patients. We also are hopeful that additional supplies will be arriving, and it looks like they will. I have to tell you that our staff has done an incredible job of being innovative. You read about these initiatives, but we've been able to secure reusable plastic, high-grade masks that are in a sense used for even worse situations, that we've been able to secure and reuse those in the system, and that's going to be great. Our priority is keeping our staff safe. Our priority is always keeping our staff safe. If they're not safe, we can't live up to our mission, and we can't take care of our patients.
Matt, we've also had a tremendous response from businesses, individuals in the region, helping bring masks, donating masks to us, and working with major employers. MAC, for instance, and their subsidiaries have been terrific. We're working with them in terms of having them manufacture some high-end masks that we can use for our staff, and it's really been kind of a remarkable story of Vermonters coming together and helping each other. And we're getting calls every day from people who want to, and it's just see what they can do. What can they donate? They're bringing masks from their areas of if they have a workshop or something like that. And it's great stories, and it's something that again, when this is finally over with, we have to tell all the support that we've gotten from many people, many organizations.
It's unbelievable. And Matt, finishing up on that planning. Since we spoke last, of course, the state has done a lot of planning. The planning is so important. How the actual plan unfolds, we'll see. But they include the 5 locations around the state to place patients who don't necessarily need to be in an ICU but need to be treated. And we have one in Rutland and then Brattleboro for us. There's also been a lot of collaboration between the hospitals what to do if one hospital doesn't have enough resources, how we can fit that in. And it's through that collaboration that we'll be able to sustain the volume of patients that is predicted in that model. And by the way, the volume will increase. I do hear people starting to say, gosh, nothing's happened yet. When is this going to happen? I see it in New York City, but maybe it won't happen here. It will happen here, but probably not near to that level because of our spread out rural area and the social distancing. What people have been doing is amazing.
Yeah. We have a question coming in, and this is a good time to do, I think, a quick update on how many patients are currently being treated locally, how many in the hospital, and how many have recovered.
Right. So we have one patient in the hospital right now that is known to be test positive for COVID-19. We've discharged several who have made it through their illness. We've had 2 deaths of patients with COVID-19. As far as the numbers of patients in the community with the disease and the numbers that have recovered, it's much higher than any data source you can see because testing is not occurring at a level where everyone is tested. We know people get the disease and get better within a few days, and they're not counted in that volume of patients.
Great. Couple other questions. When should I go? How do I know if I have COVID?
Mm-hmm.
When should I be doing that? And maybe, and we talked about this at one of the last telecasts, the idea of should I go to my local doctor, and what if I don't have a local doctor?
Sure. And that really hasn't changed, Matt, over the past couple of weeks, and I'm glad you brought it up because it's a good time to remind people. I want to start by saying the svhealthcare.org website, it's a great balance of what you need to know and then not the stuff that you just don't want to read through. And one of those main links is, what if I have this disease, or what if I have symptoms, or what if my family does? It takes you right to some really well done literature by the CDC. So if you believe you have the illness, then the first thing you do is you stay home, you contact your healthcare provider, and they'll monitor you by telephone or telemedicine even. Many are doing telemedicine. And it is very likely that you will get better over a week's time period. Once you have been a week with the onset of symptoms, 3 days without fever and improving cough and shortness of breath, you're done with your home isolation. You're not done with social distancing because that's going to go through the summer here. But lots of people have done this and they've gotten through the illness. When you should come in to the emergency department is really when you have trouble breathing, or when you're mentally not thinking well, or when you can't get up and walk around because you're too weak. And that's what we're there for, and we're ready to take care of those patients.
Great. If you're just joining us, we have on the telecast today Dr. Dobson, who you just heard from Southwestern Vermont Medical Center, as well as CEO Tom D. joining us. We want to encourage people, if you're following along on Facebook, ask a question. If you've heard something out there and you're not sure if it's true, we've got 2 experts in the room and myself, and we're happy to ask those questions to both Tom and Dr. Dobson. Tom, this one goes to you. We've done a lot of these, and we've talked a lot about our region and our hospital. I'm sure you're in contact with other hospitals, at least throughout Vermont, if not New England. How are other hospitals doing? Are they seeing the same thing we're doing? Are they struggling with the same thing? Are we doing better than others?
Actually, we have a 7:30 conference call 3 days a week now with all the hospital CEOs of Vermont. And it's a good opportunity to share notes, find out what others are doing. And I'd say it's very, very similar to what we're seeing right now.
Mm-hmm.
I mean, a lot of work being done in terms of gearing up for the next few weeks. I think probably the universal challenge has been making sure that the inventory of PPE, as Trey talked about, is high enough for all of our institutions. All of us are doing surge planning. The state's working with us on that. I do want to mention locally here is, we've created a great surge plan to expand our footprint on the hospital campus. In the event that this gets larger than we expect, we also have a fallback plan. And we're able, through the help of Southern Vermont College, Dave Newell, and some of the trustees there, they were good enough to let us use a gymnasium in the event if we need to create an extra facility. And a number of institutions across the state are doing that. Up in Burlington, they're using a large arena for, I think they're looking to create a 400-bed, mobile hospital there. So I think, everyone is getting geared up. Of course, Burlington has the highest number of positive cases. And we're trying hard to protect our workforce. So to date, we've had 4 of our employees have tested positive. And something that's why the PPE is so important, how our employees care for our patients. And that's something that all the institutions are worried about. If this is a long, extended surge, we know the number of our employees and providers will be coming down with the illness. So this is a major concern by all of the institutions.
Yeah, and the difference there, as Tom is pointing out, is we know 50 to 75% of people are going to get COVID-19, then 50 to 75% of healthcare workers are going to get COVID-19, but we don't want them to get it at work. So these individuals that have contracted COVID-19, and actually many hospitals around the state, the question is, where did they contract it? Now, when you read about it nationally, it's usually from places that got hit early and hard before they had the time to put these measures in place that we've been fortunate enough to have. But we can't let it slip. It's every day. Every day we start our meetings with, what's our priority? It's to keep our staff safe.
Great. A question coming through, I'll do my best. It's got a lot of chemicals in it, so, but maybe we can keep it simple. Does SVMC have any access to the clinical trials involving remdesivir or HCQ with a bunch of other chemicals off efforts? So I'm sure you know what I'm talking about, and so where are we at with that, Dr. Dobson?
Yes, so those trials are limited to certain locations and they are expanding. In a sense, we have access to it because our partner, DHMC, Dartmouth-Hitchcock Medical Center, is a major player in that trial. Patients that meet those criteria at this moment are eligible. They would not be treated here at SVMC. At this moment, that could change. They would be transferred to Dartmouth-Hitchcock. And again, that's also in the current climate. If the numbers of patients really exceeded capacity, then the transfer would probably not occur, and we would have to work with Dartmouth-Hitchcock to get the medication here. Right now, it's not allowed as a part of the trial because they have to keep the trial controlled.
Great. We've talked about this in other ones, Dr. Dobson, but maybe just refresh our memory. Now we're a week further into this social distancing. You can start to see people get a little bit more squirrely than maybe they would have been at the first week. What are some good tips, just as a doctor, of everything from, we had UCS on last time about mental health and keeping that active, obviously physical health, taking care of yourself. So what are some good recommendations for people now in 3rd or 4th week kind of being inside?
Right. Well, I would say also that is something else that differs from living in an urban area to living here in Vermont. And people get confused. You definitely can go outside, and you should go outside. You must maintain a social distance. And if you are in the grocery store, limit your trips to the grocery store. I think in the beginning people were going to the grocery store a lot, and they realized I really don't need to go to the grocery store that much, and only one person in the family. And when you do, you should be wearing a mask. And the purpose of that mask, there's a little bit of the purpose to protect yourself, and that's what most people think. But the real purpose there is to protect others, because if everyone is wearing a mask, less is coming out with a cough or sneeze, or even speaking is considered a way to express those respiratory droplets. And then mental and physical health is so important, and if this keeps going into the summer at the same level of home isolation, we've got to be in routines. You've got to be going to bed on time, you've got to be waking up early, you've got to be thinking about, what am I going to do today? What am I going to do for my mental health? If that's work or reading, what am I going to be doing with my kids? And then physical activity. It's very easy to say, I'm down, I'm not going to do my run today, I'm not going to do my walk, I'm not going to do my push-ups, and that's the wrong thing. In fact, this should be even more so right now.
So I'm not seeing any further questions on CAT TV coming through, so if you do have any final questions you'd like to ask Tom D., CEO of Southwestern Vermont Medical, or Dr. Dobson, Chief Medical Officer, I am getting some other questions coming through here, so we'll kind of finish with that, and you have one last opportunity to ask that question. Again, we hope to be back to you in the next couple of weeks if there are new updates from a medical perspective. Really just walking through the surge planning. I think we had talked about it, but just hit some of the high points, both Tom and Dr. Dobson, the surge planning, the PPE, rights and wrongs, and then elaborate some on the testing.
Sure. Well, for surge planning, we mentioned last time, and this is in full swing now, is we have a place called the Respiratory Evaluation Center. It's adjacent to the emergency department. Patients that cannot be managed at home, that are developing that trouble breathing, the mental status changes, the inability to think clearly, weakness, will be seen at this location. Again, you come to the emergency department and you'll be ushered into this evaluation center, and that is able to hold many patients if a surge in volume exists. And then as far as inpatient, we've made sure that we've expanded our negative pressure rooms from something low, like in the teens, to 44 negative pressure rooms to accept that. Again, the surge we'll be able to handle in the short term. It's going to tax our staff. We have to be respectful and understanding of them and giving them what they need and protecting them. But we do have plans in place for at least a double to a triple volume.
And we do want to, again, apologize to the community that we had to restrict our visiting. And that's really part for the safety of our patients and our staff members. So there is very limited visitation going on at the health system right now. And hopefully over time that can be lifted, but right now that is the case, Matt. And all this is on our website, so please visit SV Healthcare, and there's great information there. It talks about our plans, what we're doing, and some good information on how to deal with the virus.
Great.
And you talked about testing, Matt, just to hit on that. What we've been limited by, when I say we, I mean throughout New England, is the testing supplies have been restrained a bit, and it's been difficult because we want to make sure we can test people that need to be tested, and others can go home with a presumptive diagnosis. That has improved. It improves every day. Even this week it has improved, so that patients can be tested if they are symptomatic, and if the doctor or the provider believes that it will change the course of treatment. And so we are ready to accommodate up to about 25 patients per day. Again, need to have symptoms, they need to have their doctor's order. There are many patients that don't need to be tested, and so we still want to save the material for those that do.
Sure.
And that is drive-up testing.
Yep,
So
that's
it's
right.
very convenient.
Still drive up.
Yeah,
Still
not the-
drive up.
yeah.
So please, you give us a call and we will schedule you if you go through your physician.
Yeah, not through the emergency department, through your own provider.
Yep. Tom, here's a question for you. Any partnerships in terms of UCS or COVID hotline? And I'm thinking in particular UCS, but I mean, we've talked a little bit about the community coming forth,
Right.
but other strong partnerships that you're seeing.
Well, UCS has been a terrific ally, and actually we're using it now for a number of our employees who need emotional support.
Yep.
So, and speaking to Lorna, who I know was on your show last week, they're there and ready. And we're using them, and hopefully other employers, if there's a need, I would reach out to them directly.
Yep.
They have the resources, they have the expertise, and they have the willingness to help out. And they've been, again, a great ally to help deal with some of the emotional trauma that all of our people are going through.
Sure.
And partnerships is a big piece of our strategy.
Great. Some other questions coming in here. One around ticks and testing. So we're going to enter tick season, and you just encourage everybody to go out in the beautiful Vermont wilderness. Is that still happening? How do we handle now Lyme on top of COVID?
Yeah. Well, first off, I do encourage people to go out in the wilderness as much as possible. There are things you can avoid. You can avoid the lowlands with the high brush. And I'll just give an example. A lot of people go up to the SVC campus to walk around, and if you stay on the trails, you're much less likely to get ticks. When your dogs run off into the high brush, they come back covered in ticks. That's an example.
Yeah.
So they need to follow standard tick precautions, the use of the permethrin on the clothing, the high socks, the wearing of full clothes, as we talked about. But we can't be stuck in our homes because of a pandemic and ticks out there. We've got to maintain our physical health, which maintains our mental health. I will say it does put a little bit of a conundrum when people present with fever, and we're all ready to know that it may not be COVID. It could be a tick-borne illness.
Another question coming through: when will SVMC have available the Abbott or Mesa Biotech point-of-care tests?
Well, we actually do use Abbott, and we have been in communication with them. They make about 50,000 of these tests per day, and they're prioritized to areas that are seeing more disease. So we will have something like that, and I'm going to say soon. I don't know if that is 3 weeks or 6 weeks from now. And then there will, and I'm sure that the listener there who wrote that is also curious about serology testing and those types, and we will be ready with those tests as soon as they really receive approval and they're known to be effective. We do have to be careful, and there's a lot of tests being offered out there, and we do know of some of them that have not been accurate and led to a lot of problems for patients.
Great. In wrapping up, Tom, maybe you can talk a little bit more about the COVID Relief Fund, specifically through Southwestern Vermont Medical.
Yes, this is something that our foundation started recently, about a little over a week ago. And it's to help in terms of defraying some of the extraordinary expenses that we've incurred in terms of, creating isolation rooms, going out there and doing addition construction for our respiratory evaluation center, all the PPE equipment. None of this was really budgeted money, so that's what's it's there to help us with, but also to help with extraordinary cases that we're aware of people who are going through a hardship, be it employees or other people who are close to our health system. And there's going to be a lot of hardship stories we hear of. So the fund is out there to try to be a good neighbor and to help, and to help our health system care for our community.
Great. I think I'd be remiss. We've done 3 of these if I didn't say, on behalf of the many businesses in the community, and they're dealing with their own issues, obviously, but also the 50,000 people that live in this region. Thank you on behalf of them, and I don't think I can do their thanks justice, but I want to present it to both of you. Just thank you for the effort. Thank you to the nurses and the doctors.
Absolutely.
And everybody that even makes that healthcare system run. And I think we just want to send a big thank you out to those people, and thanks. Thank you.
We appreciate the extraordinary support that we've gotten from you and all the people who are in the community. It's been there is a silver lining in this, and this is one of the things that we're seeing, is that people are reaching out and reaching up.
Yeah, I think so, and I think you're right, Tom. It's interesting as we've seen this real big crisis actually take head. It really has drawn the community together, where sometimes I think we've seen where the community kind of has its polar opposite questions and things like that. So I would agree with both you and Dr. Dobson in the idea that this will be stronger together because of this. Dr. Dobson, any closing comments for our audience as we kind of close up the show today?
No, we appreciate the comments and the questions, and I'm always happy to respond. Our staff are always happy to respond to those. Just remember to follow the website. It has information on what to do if you have questions in particular. And in particular, if you do fall ill, is staying at home and staying isolated so you can get through it and not spread it to others.
Well, we want to thank you for taking some time out of your day for watching one of our telecasts. We hope to bring a couple more to you. A couple other ones we're looking into is economic relief and business relief, some legislative updates, as well as we'll have Tom and Dr. Dobson back for more updates as healthcare kind of emerges and as new things happen. So on behalf of the Chamber of Commerce and the region, I want to thank you for tuning in today. Be safe, be safe, be healthy, and take care of yourself. Goodbye.